Hey guys, I'm going to talk to you for just a minute today about the balancing effect of oils. So we talk a lot on here about if you don't have a certain oil that is recommended in a reference book or something, just use whatever oils you have because oils know what to do inside your body to help balance your systems and to create a healthy environment so that your systems can operate the way that they're supposed to, all of your body systems. And I know that sometimes that doesn't make a whole lot of sense to us because we're so used to the medical mindset of drugs that are specifically created to stop or start different processes, block certain things, that kind of thing. So that's not what oils or herbs or supplements do. Those things are natural substances, just like food, that when they are in your body, they help your body to function its best, and they help to balance out your body. So a lot of times people ask questions. There are two questions we get a lot. They say, should I use hormone balancing oils and supplements if I'm on birth control? When I was at the training a couple weeks ago that I told you guys a little bit about, and I'm going to continue to share the things that I've learned, he talked about the fact that if you are trying to balance your hormones, if that's important to you, birth control that's not a drug that balances hormones. It has a very specific effect on the body. So if you're on birth control because it's very important to you, you've studied it out, you've researched it, you decided that that's something that you want to do, knowing what all the risks are, then you don't want to do anything that's going to try to balance your hormones because you are putting your body into a chemical state of operating a certain way because of the chemicals that you're putting in there. So then if you come in with herbs and oils and supplements and things and try to balance your hormones, it's not going to do anything to harm you, but it may try to balance your body, and you wouldn't want that to happen. So when it comes to birth control, he says you really need to choose which route you're going to take. Are you going to take the natural hormone balancing route, or are you going to take the medical route? Because if you take the medical route, you don't want to be doing other things that will balance your hormones, if that makes sense. And then the other common thing that we are asked is about oils that would maybe interact with blood thinning medications. So I am not a doctor, remember that. I am just kind of sharing with you what I've learned as I learn it. And here's the thing about blood thinning medications. People who are on those medications, they're told by their doctor they have to have a specific diet. They're not supposed to have a lot of leafy greens. Sometimes they are told don't eat any leafy greens. Sometimes the doctor is really good about educating, and sometimes the doctor is not. So the reason why you're not supposed to eat leafy greens if you are on blood thinners is because leafy greens are blood thinners. So if you have a more natural-minded doctor, he might be willing to say whatever condition it is that you're on for the blood thinning medication, he might be willing, if he's natural-minded, he might be willing to say, you do need to be on blood thinning medication, but I also want you to continue eating leafy greens, and we are going to monitor your blood levels to make sure that we have a good balance here, instead of just writing a specific prescription for a specific dose because of your age and weight and gender and all the things that you fit into this little program. Instead of doing that, which is the easiest thing that doctors do, and that's what they're trained to do, and that's just what they do, it's the safest route. That's the safest route for them. But when a doctor is more interested in nutrition, he or she might be willing to say, I really don't want you to compromise your nutrition, so I want you to continue to eat leafy greens in moderation, and I'm going to monitor your blood levels, and we'll adjust the dosage of your medication based on those results. It's the same thing with oils. There are some oils that could have a blood thinning effect, and so doctors will say, don't use those oils if you're on blood thinning medications. Well, again, it's the same thing as the leafy greens. If you have a doctor that is willing to embrace both sides. Like there are integrated medicine doctors who they have a naturopath side and they also have an MD, and so they integrate the nutrition and the medical model. If you have a doctor like that, which I think everyone should have a doctor like that, because a lot of doctors don't even talk to you about nutrition, and our gut makes up 80% of our immune system, and I don't know how you can even talk about health without talking about nutrition. So I think that we need to make sure that the doctors that we choose know a lot about nutrition. That said, oils are created by God to help balance our body systems. So if we use them in the right way, then they will do just that. So I kind of got off track and I was catching up with my brain. They are called adaptogenic. And so the way that Dr. Hagerton explained that is that they adapt to what your body needs. So it's kind of like with some people you see peace and calming has more of an energizing effect. And then with most people, it has more of a calming effect. But with some people, it doesn't. So what happens is those oils get into your system and they do what your system needs for them to do. Because of that, he says that you don't have to worry about oils or herbs pushing you too far in any direction, because your body will take what it needs and then it will excrete the rest. So it's not like there could be a toxic overload buildup like there can with certain kinds of vitamins. I think that vitamin C is one of those examples that if you get too much vitamin C, pretty much it just is excreted in your urine. And it's hard really to get too much, but if you do, then it's just excreted in your urine and it's not going to damage you. Obviously, everything needs to be done in moderation, but when we're talking about oils and herbs, they are adaptogenic. Drugs are not adaptogenic. They have a very specific job to do. They've been created to do a very specific thing, and that's either to block something in your body from happening, or to induce something to happen, or to alleviate something, to get rid of something. They have a very specific job, and that's all they do. And so that's why we have to be a lot more careful that we follow exact dosage when we're talking about medication or over-the-counter drugs than we do with more natural substances. So it just goes back to what we talk about a lot, that oils are nutrition, whether they're nutrition that you put on your skin, that you breathe in through a diffuser or just from the bottle, or whether you take them orally. They're nutrition. They get inside your body. They affect every blood cell in your body, regardless of the way they enter, and in that way they're nourishing your body. So I hope that this makes sense and sheds a little bit of light on just the way that oils work and how they work in conjunction with medication, and how they are not going to work against the medication necessarily. They're not going to have a contraindication as far as doing harm, but if you're looking to do something specific with your medication, then you need to decide whether you want to have that outcome or whether you want the outcome that you would receive from going the more natural route and looking at your overall nutrition and your oils and supplements. Thanks, guys. I hope that helps.